Good morning, everybody. Welcome. How are you today? Welcome to this live stream here on YouTube. My name's Claudia Rose, formerly known as Claudia Lefebvre, but Claudia Rose, and I'm a nutritional therapist and eating psychology coach with 18 years clinical experience. I lecture at various nutrition colleges, and I'm here on YouTube every Friday at 11 a.m. So please like, subscribe, do whatever you need to do so you get notifications. And this week, we're talking, it's so lovely to see you all. We are talking about nutrition for cognition, part 2. Now, last week, we talked about some of the underlying drivers that can fuel and drive problems around cognition. We talked about inflammation, poor antioxidant status. I'm sure we talked various things. We talked about impaired blood flow, obesity. We talked about the relationship with our gut and this, the blood-brain barrier, these bodyguards that protect our brain. So we covered a lot of underlying mechanisms and hopefully gave you some clarity and understanding around that. And then today we are going to be looking at the diet. What can we do from a food point of view? Understanding these drivers, what does that actually translate to in terms of what we're eating? The food on our plate. Food is the foundation. And then next week, we're going to look at some supplements. I think I got a bit carried away last week. I think last week I promised you supplements today, but food always comes first. Food is the foundation. Supplements are supplemental. Okay, so we're not leading with supplements. We don't lead with supplements. It's always a food first approach that's the best. So that is what we're doing today. So before we get stuck in, I'm just wondering how many of you managed to look at foodforthebrain.org last week and do the cognition test, because it's very interesting. And if you haven't yet, I really recommend you take a look. Foodforthebrain.org, and then find the cognition test and just get a number. Get your number, get your rating, and it will factor in some of the lifestyle factors. And we're going to lead today, before we get into the food, the precise food on our plate, we're going to be looking at some overall lifestyle factors that can really help or hinder our cognition and our ability to think clearly. Now, one of them is sleep. So when we know that when we're exhausted, we don't concentrate well, we can't focus. It's hard. I mean, I totally get it. We all know this. But did you know with sleep, it's like if you've got cognition here and you've got sleep here, it's like a J-curve effect. So, and the ideal, in terms of the ideal, or it's like the other way around, I suppose. It depends how you're looking at the cognition. But the optimum is to have around 7 hours sleep if we possibly can. We know that we don't do well if we don't get enough sleep. But did you know that oversleeping is also not good for our cognition? Have you ever had it where you've slept in a bit too long and you just feel like fuzzy-headed and not quite with it the next day? So around 7 hours is optimal. I do understand that it can get harder as we get older. It can get harder to have a good night's sleep. Menopause, perimenopause can be severely disruptive in terms of sleep. And maybe we'll do a whole nother session on sleep one day, nutrition for sleep, because there's certainly a lot we can say about that. So making sure your sleep is good is really important. Making sure your anxiety is controlled as much as it can, because like we said last week, when you're in pain, chronic pain can absolutely affect your ability to concentrate and your cognition, but so too can anxiety. We can get this sort of burnout, feeling totally fried. So managing anxiety is very important, and also manage stress. So people who don't have any stress in their lives, like zero stress, don't tend to fare as well as people who have some stress but know how to manage it. So we do. I mean, I don't know anyone who doesn't have any stress. I don't know about you. There's always seems, and sometimes I feel like if we don't have stress, we somehow manage to create it ourselves. I don't know if you agree with me on that. But manage stress and see there can be positive stress on the body. And this is where last week we were talking about the benefits of cold showers and some of these shock systems to increase our output of NRF2, which has a very, very protective effect and helps build our resilience. Actually, since last week, I saw some really encouraging research that showed that said that actually the ice baths and the freezing cold freezing cold water is not so good for women, because it really triggers a full sympathetic reaction, a full adrenaline and cortisol reaction. So we're better off with not freezing cold, but a bit cold, apparently. But women do very, very well with the sauna therapy. Our bodies have different composition to men. We have higher fat intake, higher fat body percentage generally. And it impacts on how our bodies react to these kind of external stresses. But not all stress is bad. We just need to know how to manage it. Exercise, again, really, really important for those endorphins, for the circulation, to help us feel more focused, more relaxed, everything else. So I know for those of you who've been with me for a little while now over the years, we've talked a lot about Dale Bredesen and his amazing book called The First Survivors of Alzheimer's. Now, he is a functional medicine doctor who's dedicated himself to dementia, different forms of dementia, and the nutritional and overall research around that. And I'm just going to tell you the areas that he looks into, because there's going to be a lot of overlap with what we talked about last week. So when he's looking at cognitive function of his patients, he goes through, and some of this is lifestyle, some of it isn't, but he looks at, number one, insulin resistance and the whole blood sugar. We talked about that last week. It looks at inflammation, brain inflammation, hormones, what's going on with the hormones, what's going on with the toxins and exposure to mold. Those are his big areas that he looks at. And restoration and protection of dysfunctional synapses. So the synapses of how neurotransmitters are transmitted throughout the body. And we're going to be talking about protein now, that protein and cognition. Let's move on to actual food and dietary approaches. I'm just seeing, oh, brilliant, excellent. Lots of people saying, yes, we did the test. Brilliant. I did. I'm very happy that was average for my age or younger. Don't always feel like that. What a result. And it's something that you can come back to. You can think, right, I'm just going to do this every 3 months. Why don't I make some changes to my diet based on what we're going to learn today? Or after next week, do you know what? I'm going to try that pycnogenol or nitric oxide or whatever it is that I'm going to talk about next week, or omega oils. I'm going to get onto those, and then I'll retest my my cognitive test in 3 months' time and see the results. Excellent. One lady saying, I do the colder shower at the end of the morning shower, but couldn't go freezing. Glad of this info today. Yes, so please just know it's still having an effect. Women don't need to go for the full freezing for it to have a positive effect on the body. In fact, full freezing can be too much of a shock for us women, apparently. Okay, excellent. One lady said, I've done quite well too and was very surprised. Do you know what it is? Because I know a lot of you here are from Goldster. It's all your learnings on Goldster and, keeping your brain, the brain is a muscle, and keeping all your cognitive function really active and doing all the brain gains, the brain training effectively, like coming to listen today is activating your brain and your muscles there. So let's talk about protein now. Now, protein is crucial for the production of neurotransmitters that help the brain. So neurotransmitters are, for example, serotonin, dopamine, you've probably heard of. These are created from amino acids. Protein in our diet, we eat the protein like chicken, fish, There's protein in chickpeas, lentils, tofu, nuts, seeds, avocados. Just as an example, dairy also contains protein. Now, when we eat the protein, it breaks down into amino acids, and different amino acids are needed for different neurotransmitter production. And the protein is associated, higher protein is associated with higher cognitive function. Now, it could be that if someone is very carb heavy, their blood sugar's imbalanced. Is that why? Or is it because if someone's eating more protein, they're producing more neurotransmitters? We don't know. We don't know. But the research shows that people who eat more protein do particularly well in memory and executive function domains. So we need to make sure we're having sufficient. I'm not talking excessive. We all know what happens if someone goes too far with the protein. Think back to Atkins. It's the bad breath. It's the constipation, the piles, the hemorrhoids. we need quality carbohydrates in our diet. Carbs are not the enemy here, but we need like the brown rice, all the B vitamins, the fiber, all that lovely vegetables. But just every single time we eat, to include some protein. Now, this can be challenging for vegans in particular, but it's just switching things out. And especially for women, as we come into peri or menopause, it becomes even more crucial and even more important to slightly reduce the size of the carbs on our plate and just make sure that we're having adequate protein, that we're getting at least a palm size of protein with each meal. Very, very good. Yes, another study that I'm looking at here is an extreme decline in protein intake for most food groups significantly increased the risk of cognitive impairment in subsequent years. So we want to make sure. It can also potentially reduce inflammation, support muscle retention. We know I'm always talking about making sure we've got good protein balance to maintain the lean muscle in our body. And we know that is one of the single best things we can possibly do to support our longevity is maintain our lean muscle mass. But it also helps with the brain. It helps maintain neuronal integrity. So even more reasons to love our protein. Now, bearing in mind we're going to have adequate protein, what's the best overall nutritional approach to helping cognitive function? There are three main diets and three main approaches. I don't like the word diet, but three main approaches. So number one is the Mediterranean diet. It's absolutely categorized. I just think of, oh, lovely. I'm watching the Durrells on Netflix at the moment. I'm really enjoying it. So I'm like casting my mind to Corfu, and I'm thinking of all that beautiful olive oil that's so high in polyphenols, the oily fish, maybe some grilled sardines, some mackerel, and all the delicious vegetables. If some small dairy, if people want dairy, maybe in the form of goat's cheese, for example, just a low alcohol and just a beautiful, beautiful way of life. Multicolored rainbow plates of food, of different vegetables, and really a real focus on whole foods. Everything made from scratch, just beautiful. So that's the Mediterranean diet. The DASH diet is the second diet, which is an American, I want to say version, but it's an American equivalent of the Mediterranean diet. And it's short for dietary approaches to stop hypertension. So there's a lot less salt. So this was created by, I think it's the American Heart Association, or one of those big bodies to help people reduce their blood pressure, and it really is very effective at that. And it also obviously loves lots of colorful veg, but it's a very big focus on cutting salt intake, dramatically cutting salt intake, and reducing the saturated fats. Whereas in the Mediterranean diet, occasional red meat is allowed, and you've got all the lovely olive oils. DASH is more of a reduction in saturated fats, but it does also include the whole foods. And then lastly, the third approach, which is a combination of the Mediterranean and the DASH together, really, is called the MIND diet. MIND. And MIND stands for, let me get this right, Mediterranean DASH hyphen, so Mediterranean DASH, intervention for neurodegenerative delay. So that is the MIND diet. And it was specifically designed not long ago in 2015 for brain health. So it's a combination of those two approaches, but it's a real focus on berries and dark green leafy veg, elimination of potentially inflammatory foods, and it's interesting. Let me see what else. It's got olive oil in it, whole grain, fish, beans, poultry. I think perhaps there's a little bit more of a focus in MIND diet as well on the gut health. It's really looking for the balanced brain gut microbiome situation to be helpful, but it's also very neuroprotective from reducing so all those lovely veg and all the rainbow color of different veg, they're all going to help reduce oxidation, and so they'll have big antioxidant potential to help reduce inflammation, reduce oxidation in the brain, improve the gut microbiome. So it's, if you missed last week, it might be worth watching that, because I set the context for all of that. But they've been, so far, there was a review in 2023 about how effective the MIND diet was. And there were and they looked at 19 studies, and they concluded a positive correlation between adherence and cognitive function and a reduced risk of cognitive decline. So the bottom line is, if you're concerned about your cognitive function, get onto the MIND diet. And if you're just wanting to nourish your body and do everything you can, but you're not particularly concerned about your cognitive function, I would stick more with Mediterranean diet. If you've got blood pressure issues, and we need to bring the salt down for sure. So DASH might be a good option for you. So and next week when we talk about the supplements, it gets really exciting. I get really excited because there's some really new research that's, like I say, it's very exciting. I don't want to let the cat out of the bag. But carrying on with, so that's food, basically, food diet. We're wanting lots of fruit, lots of whole grains, nuts and seeds, oily fish, all those omega oils, the olive oil, green leaf, quality poultry. Be careful with poultry these days. Chicken has become so fatty that if you possibly can get higher welfare chicken, it's worth it. And then with chicken, what I try to do mostly when I can is get a whole chicken, cook a whole chicken, because you do want the dark meat as well. Don't just be buying chicken breasts from the supermarket. It's very expensive. And then there's much lower nutrient status in the chicken breast compared to the chicken thighs. The chicken thighs have got a lot more minerals like iron, zinc, etc. And people always think, well, it's very fatty. Yes, but it's got a lot more of the good stuff. And I have to say, I now eat the chicken skin because it's collagen. And I'm thinking I need all the collagen I can get. And then in terms of what we're cutting down, generally these diets have quite low dairy intake, I must say, just because cheese is very high in saturated fat. Alcohol, obviously, we're going to talk about now. Red meat is low intake. Now, all the studies, again, around red meat, they're so obviously implicated in heart disease and everything else. But I think there's going to be a shift in how people think about red meat, because so far all the studies around people who are consuming burgers, well, if you're consuming burgers and processed red meat, chances are you're consuming the French fries that go with them. Whereas it is quite a different food if you were to have a quality steak. It's much lower in fat, higher in protein. Or if you were to have some game or something like that, it is a completely different food that is nowhere near as dire in terms of health consequences. And obviously cutting down on the processed foods as much as possible. When we have processed foods, we just have no control what's in them. And this is where you all know the Yuka app, the YUKA, the Yuka app is just amazing for you. Just scan the barcode, download the app for free, scan the barcode of the food, and it will tell you exactly what's in it and whether it's a good option or not. Right, so that's food. Let's talk about hydration and what we're going to be drinking. I've got my lovely rhubarb this morning. So hydration status is really, really important for cognitive function. Have you ever felt thirsty and noticed that when you feel thirsty, your concentration goes a little bit? So actually being properly hydrated is really, really important. And also in the longer term, poorer hydration status, in one study that I'm looking at right here, poorer hydration status was associated with greater global cognitive decline over a 2-year period, particularly in men. So we need to make sure that we're hydrated. The thing is, when we're thirsty, we're already dehydrated. I got caught out yesterday. I was in the office. I was like, oh gosh, I'm so thirsty. I haven't had enough to drink today. But so there's certain things we can do. And I know as we get older, you see our thirst mechanism can decline a little bit. So we're not always so aware of this feeling of thirst. So just know that the time of day you are likely to be the most dehydrated is first thing in the morning when you wake up, because hopefully you've gone 7 hours of blissful sleep and you obviously you haven't been drinking during those 7 hours. So really important, when you wake up, have some water. I put collagen, marine collagen in mine. That's my ritual every morning. But you do you, and whatever works best for you. But just try. First thing in the morning is a really, really good opportunity to drink water. I meet so many people who say to me, I just don't want to be glugging lots of water in the evening because I don't want to be up going to the loo all the time. So this is where make the most of the morning. Don't be glugging lots of water just moments before you have your meal because you don't want to dilute your stomach acid. Don't necessarily be glugging back at all. You want to have sipping slowly through the day is the best way. I always liken it to my my house plants, and how if you forget to water your house plant and then you walk past it and you put your finger in, you go, oh gosh, it's really dry, quick, let me water it, and you put a load of water on and then it all pours out underneath, doesn't it? Because the soil can't absorb it. It's much better to be giving slow amounts of water. And it's the same for our kidneys, because the kidneys go, oh my gosh, water overload, quick clearance. And it's much better to be slowly sipping your water. People ask me about how much water should I be drinking? And, in terms of fluid, your soups, your coffees, your teas, everything all counts obviously towards your fluid intake. But around 1.5 to 2 liters a day, as a minimum. And then if you're exercising, you might want to do more. If you're sweating a lot, you might want to do more. If you're going to saunas and things like that, how wonderful, but you'll want to drink more water. And then lastly, in terms of drinking and what with beverages, alcohol, obviously. I mean, we know alcohol depletes our B vitamins quite dramatically. B vitamins are so important. Last week we talked quite a lot about B12. and its effect on cognition, and how actually some people have even gone down the route of thinking they're developing Alzheimer's disease when in fact it has been B12 deficiency. So B vitamin is very important, but inflammation is driven by alcohol. Alcohol fuels inflammation in the body. Absolutely. It reduces our energy production. Of course, it can affect our liver function. It also affects how much oxygenation happens in our body, and oxygenation is very important for cognitive function and concentration. And we're going to talk about that next week when we talk supplements. But actually, alcohol can really affect the structure of the brain as well. So I've got another little study here. I'm enjoying giving you lots of facts here, so I hope it's digestible for you. But one study, those consuming over 30 units a week were at the highest risk of altered brain structure compared with abstainers. Even those drinking moderately, 14 to 21 units a week, had 3 times the odds of right-sided hippocampal atrophy. Atrophy means shrinking. There was no protective effect of light drinking. That's 1 to 7 units over abstinence, because that always used to be the case. And they say, oh yes, have a glass of red wine. Very, very protective. But the research is saying nowadays the research is saying there's no protective effect. In fact, there's no safe level of alcohol in terms of cancer prevention. But I think in the past it was always this J curve where if this is mortality along here and this is alcohol up here, it was always started as zero alcohol was here, and then mortality reduced when people had about 1 glass of wine, and then it went up. And I think the reason, what people are saying now, the reason that mortality was slightly higher in people who didn't have any alcohol, maybe they were former alcoholics, maybe they had liver conditions, maybe there was a medical reason why they weren't drinking any alcohol, because for studies and research it's very difficult to find people who aren't drinking alcohol. So that is the thoughts now. But a higher alcohol use was also associated with differences in corpus callosum, the white matter microstructure, and a faster decline in lexical fluency, which is our speed of word generation, apparently. So we want to reduce the alcohol. So, okay, right. Let's have a little look at some of the comments here. Oh no, you don't have to commit. You don't have to commit to a test. No. You don't have to pay anything for the Food for the Brain cognitive test. I don't know. Maybe you went down a path of buying some of the supplements. You don't need to do that at all. You can do the test separately. Oh, have I heard of the HBD, the human being diet? No, but I like the name. I think there should be a diet, actually, FBD, female being diet, because we are so different. Can I recommend a mind book to read? Oh, yes, I can. Let me have a think about that. There is a really good book, but can I remember the title? I would definitely start with The First Survivors of Alzheimer's by Dale Bredesen. It is such a good book, and it's so inspiring because each chapter is about a different patient who has reversed their Alzheimer's and literally reduced the amyloid plaque in the brain. And each person has a different underlying drivers going on. And it's fascinating. It's really fascinating. Or you can also look up on YouTube. There are lots of interviews with these patients as well. So that's a good one. Oh, off subject. Do you know anything about Irish sea moss? I'm intrigued by Irish sea moss. I haven't tried it yet, but I've been looking at purchasing Irish sea moss gel just to try it out, because I don't tend to talk about things or like advise you guys to do things without having done it myself first. So that it is actually on my list. And I think it's a beautiful, really nourishing food to add in to like a smoothie or a casserole. I was thinking it's a good one that you can sneak in without family knowing what you're doing necessarily. If you it would be really good for example, people with teenagers, if they're a bit worried that they're having too many ultra processed foods when they're out with their friends, sneak some sea moss gel in. I would say that if you're taking seaweed supplements, so if you're taking Dr. Seaweed supplements, you've probably got that kind of nourishment covered. But it is interesting. The thing with the sea moss gel that would slightly put me off is that it's only fresh. It only stays fresh for 21 days. You get a big bottle of it. So I was thinking, right, I need a stretch where I'm definitely at home. I'm not going away, because I wouldn't want it, obviously, it to go to waste. Excellent. I'm still using the Yucca app and have told lots of friends. We can then choose it if it's the additives that can be scary. Exactly, those numbers. And we're not encyclopedias, are we? We don't know, when we're looking at the label ourselves, we might be blissfully ignorant as to what actually is in there. Or it might be fine, because some numbers are literally calcium or turmeric, or just they're harmless. With numbers, you've got the good, the bad, and the ugly. So it's just so helpful to have this app decipher it for you. Okay. What protein powder should I buy, whey or pea? So protein powder is a good option if you're just aware that you're not having enough protein in your diet. It is a good idea. Whey protein is derived from dairy, so I'm personally not a fan of whey protein. And again, all the studies are around men using whey protein, and not many around women. So I would veer more towards the pea protein myself. But there's some really interesting protein powders as well now. I'll have to find out the names, with like mushroom all the ground mushrooms from the the cordyceps and the reishi, and there are some good products on the market now. Okay. Sea moss is also expensive. Made my eyes water. It was so yuck. I think it needs to be disguised. Oh dear. But well done for trying it. I love that you gave it a go and tried it out. So fantastic, everyone. Well, thank you so much for joining me today. It was really good to see you all. And looking forward to next week. We're going to go into the supplements, which there's some, like I said, I'm a bit overexcited about the supplements. I have to control myself, but I'm taking quite a few of them myself, and I've been seeing results. So have a great weekend, everyone, and see you soon. Okay, bye.